My back pain started in April of 2014. I was in a car accident. Somebody ran a stop sign and T-boned me. So I was in pain for about a year before I found Dr. Valente. I was on crutches, I was using a walker, cane, I was on bed rest, I couldn't work, I couldn't drive, anything really. Psychological torture, just to not be independent. You know, I was 21 when my accident happened, and so just giving up my independence, my freedom, my livelihood to be in pain all the time. After, you know, being in pain so long, you kind of get down and get miserable, you know. So we did chiropractor for about 6 months and had no relief. I did 3 rounds of the spinal injections and had no relief. Did physical therapy and that hurt worse than everything else. I did some things in the pool, some aquatic, you know, stretching and things like that, but it was just miserable. So finally we went ahead and I did a discogram. Once we did the discogram and saw how bad it was, we knew that surgery was the only option. And then I found this one. First visit was awesome. I went home from my first visit smiling. I was like, I think this is the one. And they, you know, listened to me. They did some test evaluations. They did an x-ray as soon as I got there, which nobody else had ever done. And he came in, he was just honest, open. He said, okay, this is what I can do. This is the, you know, the likelihood that it'll be beneficial for you. He gave me all the facts and he said, but I'll let you choose. And so, like I said, I left the appointment and I was like, okay, this looks promising. He sounds like, you know, I can trust him. To combat that, I researched everything. Everything and anything. I probably know more about you than most of your other patients. I looked up, you know, everything I could find. Anything attached to his name, I looked it up.
You know, I think it's real important that the physician or myself arm and empower the patient with knowledge and what the facts are surrounding their problem and what the options are, conservative options, surgical options, and then what the chances are that it's going to make you better. And at that point, you know, if it's not a surgical emergency, which, you know, 90+% of spine problems are not surgical emergencies, then I really think it's up to the patient to decide how they best want to treat themselves. So what I usually do at that point then is, after I've empowered the patient with the knowledge and the facts, is, you know, help them see all the options. And typically that includes anything from most conservative to most aggressive, being most conservative being, you know, trying to live with it as long as you can. You know, hoping it gets better on its own, hoping it doesn't get worse. You know, taking anti-inflammatories and light pain medications when you get a flare-up, right? Option number 2, you know, physical therapy, chiropractic care, which she did, right? To strengthen the core so that there's hopefully less pressure and micromotion on your painful disc and your pinched nerve. That can sometimes help patients relieve their pain. Option number 3, injections, which she did. You know, epidural steroid injections that the pain doctors can give to try to decrease the inflammation of the injured or torn disc and decrease the inflammation of the pinched and irritated nerve. And that oftentimes can give patients significant pain relief. And lastly, option number 4, which is a surgical solution, if there's a biomechanical problem that I can relate to the patient's symptoms that I believe I can make significantly better with a surgical procedure. Then at that point, if I have a high level of confidence that I believe a procedure could make the patient significantly better, then we offer and talk about that option as well. So then you lay out all of the options, and at that point, you know, we have a discussion as to which way the patient wants to go. And I think in this situation, you know, Mrs. Johnson, she'd really exhausted all option 1, 2, and 3, to the point where when she came into my office, she was in tears and using crutches for a year. And I think it was pretty clear to me which option she was going to pick at that time.
Definitely. I like that you said that you use the information to empower the patient, because that's how I felt, really, because I can't tell you how many doctors I went to and they were just like, well, this is just how it is, you know. They were like, well, take a few years and see if it still hurts, or, well, these are the only, one of the options they gave me was like a battery pack.
Spinal cord stimulator.
Yes, yes. And they were just, they weren't really invested in empowering me. Like, I didn't feel powerful at all. I felt like a victim. I felt like everybody else could hold my future in their hands but me, And so, and then the hands that, it was potentially in weren't exactly the, toughest hands, So once you said empowered, it really made me remember how those, little things like the information you gave us and, the concern that you showed, it really did make me feel empowered.
So the surgery Mrs. Johnson had was what we call lumbar 360, where me and a vascular surgeon make a small incision from the belly button, below the belly button down, and the vascular surgeon moves the blood vessels to the side. I take the disc out and put a spacer block in where the disc was. And then I go in the back, minimally invasive in the back, 2 1-inch skin incisions, where I free up the nerves, take all the pressure off the nerves, make more space for them, and then put in the screws and the rods to hold the 2 bones still so that her bones will grow through the hole in the spacer block that I put in through the front, and that'll give her the stability that she needs. And with that procedure, you're usually in the hospital anywhere from 1, 2, or 3 nights, just depending on the patient. You can be up and walking the night of surgery. It hurts because you just had surgery, but walking is the best thing for your recovery.
They said walking is the best thing for you. The more you walk, the faster you heal. So let's walk. Let's do it. Let's do it. Let's do it. So the nurses would come, and they were great too. The staff there would help you get out of bed and walk with you and everything. And they were great. They were very positive. And when it got to be, a little difficult or too much, they would encourage me and things like that. So it was all positive after. I was able to walk up the stairs by myself right after surgery. I think this was day 3 or 4. And I kind of get emotional thinking about it because for a year I couldn't even lift my feet to, go up the stairs without being in pain. So right after surgery, I was like, okay, this is already showing me results. 3 months after, once I did my 3-month checkup, I treated myself to a trip to St. Thomas. And yes, so I did all that, flew out there. We did long car rides there. We were in the ocean. We, hiked around, did tourist things. And 3 months after, I could do all that. And so now it has been just over a year. I can dance, I can walk around, I can play around. I'm working a little bit. I haven't pushed myself too much, but I know I can definitely do more than I could before. Back pain is probably one of the most crippling kinds of pain because it affects so much, But now I'm happy. Happy, healthy, active, grateful, definitely blessed. If you're at the point I was at where you're miserable and you're not living life, I've recommended Dr. Valente to several people.
Because a lot of times patients ask me after we've discussed what their diagnosis is and their treatment options, they'll say, what would you do? If I was your mother, what would you do? Right? And the answer that I give is that the reason why I can't answer that is because I don't know how good or how poor your quality of life is. For me, if my quality of life was so bad, I couldn't work or provide for my family, that's my threshold. Then I would have surgery, but for other people, that threshold may be different. So I really think that it's an individual decision, that person and their family and their loved ones, have to make.
I really want to thank you. Like I said, I was in a very down place. Being that hurt for that long took a big toll on me. I really feel like you were, like I said earlier, the one. You're my answer. I went to so many people. So many people looked me in my eye and just gave me the runaround or dismissed me, and you never did that. Any appointment I've ever been to, you've been direct, you've been concerned, And I really thank you. And I really do tell people all the time, you're the best. I tell them, go see my doctor. He's the best.
Well, I just want to say I'm so happy for you. You know, when you came to see me, you were using crutches, you were crying. I mean, it broke my heart to see, you know, a young woman, you know, like that. You know, when you should be in the best years of your life, you know, enjoying your life, you know, going to school, working, enjoying your family, your nieces, nephews, your boyfriend, I mean, your whole social network in life. But that's not the person I saw in my office. And I'm just happy to be a part of giving you your quality life back.
You don't have to live with pain. Go to thisspine.com for more information.